First of all, consider a cervical vertebra. So, a typical looking cervical vertebra. First of all, you need to know that there's a total of 7 of these vertebrae. And they are named specifically as C1, C2, C3, C4, C5, C6, and C7. I'm not asking you to pick up an individual vertebra like this and tell me whether it's C5 or C4 or something like that, but I do expect you to pick it up and say this is a cervical vertebra. It has all the basic component parts as all the rest of the vertebra, but the thing that it has that all the other vertebrae do not have are foramen on the lateral sides that are within the transverse processes. These foramen are transverse foramen, and only cervical vertebrae have those. So if you pick up the vertebra and you see these transverse foramen, then you know automatically that it's cervical vertebra. In life, a pair of arteries called the vertebral arteries pass through there on their way up to then pass through the foramen magnum to enter into the cranial cavity and serve as some of the major arteries that supply blood to the brain itself. So we've got this. Now then, another feature about cervical vertebra that it can also make them very specific is the first cervical vertebra and the second cervical vertebra. So the first cervical vertebra is really very unique. There's no other vertebra that is like it. And because there's no other vertebra quite like the first cervical vertebra, then this one has a specific name, and it's called the atlas, because this is the one that the skull is going to be articulating with. Atlas for holding up the world, atlas for holding up the head. You can easily determine that this is the atlas by looking at it because it's the only vertebra that has no body. So you see this rather large vertebral frame, the spinal cord would pass through, but there is no body. Like any other cervical vertebra, it has the transverse foramen, but again, no body. It has very large superior articular processes, being the depressions that the vertebra will use to articulate with the bony structure above it. And these very large superior articular processes fit very nicely onto the occipital condyles of an occipital bone. So if I take a skull, you see the occipital condyles, then the atlas fits onto those occipital condyles. Try to get my fingers out of the way so you can see that a little bit better. And with this type of a joint, then the motion that is permitted is a forward, back, and forth, as if you were nodding your head to say yes. So be able to specifically identify the atlas. The second cervical vertebra is also unique. There's no other vertebra quite like this one also, and so therefore it is specifically called the axis. So C2 is also called the axis. Again, you can see that it's a cervical vertebra because of the transverse foramen that are within it. But what makes it unique is this little piece of bone that is extending up from its body. This little piece of bone here is the odontoid process, or an easier way to name it is to call it the dens. I think the term odontoid process is the one that's in the syllabus, but dens is probably the more commonly used term for obvious reason. Anatomically, this is actually the body of the atlas, the first cervical vertebra, that is now has fused with the body of the second cervical vertebra. But this dens is going to serve as a pivot point. So if I were to put the atlas and the axis together, like so, then you can see how the dens fits into the atlas. It will serve as a pivot for rotation. So when you turn your head side to side, as if you were trying to say no to an individual, then the movement is between the atlas and the axis. Again, I'm going to slip my finger in here to mimic the spinal cord. So again, the body of the axis would be anterior, so you're looking now at the anterior side. You've seen that spinal cord, but I want to tip it a little bit so you can still see that dens. And you can also see the precarious position here, and that if you break your neck, then part of probably maybe breaking your neck is breaking that dens. And if the dens just simply gets cracked but stays in its position normally, then you can see why immobilizing the head is so critically important, so that dens does not get dislodged. If that dens does get dislodged, it's probably going to get jammed posteriorly right into the soft tissue of the spinal cord. In this case here is illustrated by my finger. The nervous tissue in the spinal cord, at that level of the spinal cord, contains the origin of the nerve supply to the nerves that work your diaphragm. So your diaphragm will immediately be paralyzed and you'll die of respiratory arrest. So the atlas and axis, very two very unique individual vertebrae. Now, I've showed you how to identify a cervical vertebra. A thoracic vertebra is easily identifiable also, because first of all, you have 12 thoracic vertebrae. They are named T1, T2, T3, and so forth through T12. You also have 12 pairs of ribs, and the 12 pairs of ribs will articulate with the 12 thoracic vertebrae. And it is that articulation point that makes the thoracic vertebra unique. So you would look for structures that are called demifacets, which are the points on the thoracic vertebra where the ribs articulate with. Where you would look for the demifacets is a smooth spot right on the tips of the transverse process, and you will also find it as a smooth spot on the bodies, on the side of the body, just right below where the pedicle comes out of that body. So demifacets here and here. So the ribs articulate at 2 points. The head of the ribs articulating here, the tubercle of the rib articulating here on that transverse process. So if you pick up a vertebra and you look at it and you see no transverse foramen, you know it's not a cervical. And if you look at it and you see demifacets, then you definitely know it is a thoracic vertebra. Now, the lumbar vertebrae are the largest and most massive of the vertebrae. They're the ones that are going to have the largest bodies because they're the main weight-bearing vertebra of our vertebral column. But they're going to have all the other features that each individual vertebra is going to have also, in that they will have the spinous process and the transverse process. They're going to have the vertebral foramen. They're going to have pedicles. They're going to have the lamina rather, and the pedicles all attached to a body. But what they won't have is they won't have any transverse foramen in the transverse process, so you know that that makes them not a cervical. And also, if you look at the sides of the body, you see no smooth spots or demifacets. And if you look at the sides of the tips of the transverse process, you don't see any smooth spots there neither. So there's no place for ribs to articulate with, no demifacets. So use a process of elimination. If you see no demifacets, you know it's not thoracic. If you don't see any transverse foramen, you know it's not a cervical. So therefore, by process of elimination, it is a lumbar. Now one might think, well, I can identify it by the large body. Well, that's kind of dangerous to do it that way, because if you look at this vertebra here, you might say, well, okay, this looks like a lumbar vertebra because of the large body. It's smaller than this one, but I could say that it's maybe smaller because it's from a smaller individual than what this one is. But to be careful, always check out the bodies. And notice on this, the little smooth spot right here, that's a demifacet. And so therefore, this is a thoracic vertebra. The 11th and the 12th thoracic vertebra have large bodies, like what lumbar vertebrae do. And they do not have a demifacet on the transverse process, they only have it on the bodies. Because the 11th and the 12th pair of ribs are floating ribs. And one of the main reasons they're floating is that they articulate to the vertebrae at only one articulation point rather than two, like all the other ribs happen to do. Okay? Now, one other feature about these to determine what type is if we look at the sacral vertebra, comprising one big bone called the sacrum. Now, this is made up of 5 vertebrae that have fused together. You can even see the fusion lines. So this is an easy one to identify, because you know this is definitely not a cervical or a thoracic or a lumbar, so definitely the sacrum. But again, you have the intervertebral foramen, where the nerves would be coming out. You have the body. You've got vertebral foramen for the tips of the meninges from the spinal cord that would extend down there and so forth. So it's got all the basic components of what any vertebra is going to have.